we've got a report out today which suggests a third of young survivors of the Manchester Arena attack haven't received the mental health support that they perhaps would have liked. They've not received any professional support. You've spoken out about wanting to challenge the stigma around mental health and about your own mental health. Have you sought professional help for your own mental health over the last few years, can I ask?
Well, firstly, dealing with the Manchester Arena young people, it's an outrage they've not received the help they need. We do know there's big problems with child, adolescent mental health services, but it's not good enough. And the more delay there is before you receive professional help, the worse your mental health gets. I'm blessed. I'm surrounded by experts in relation to my physical fitness and my mental fitness, both of which haven't been 100%. But the key thing is to get advice, particularly if you're a man. My gender, my sex don't talk about when we're having problems. We bottle it up. And that's why one of the biggest causes of death of men my age is suicide. So I've talked about my mental ill health during the pandemic, but also because of the cumulative impact, been doing a stressful job for a number of years. And I've got help and I'm better for it. And the same goes for physical fitness as well. We're not embarrassed to talk about being physically unwell. We've got to not be embarrassed about being mentally unwell.
In your book, Breathe, you talked about the possibility that you think you may have had a minor heart attack at the COP26 summit. I mean, in terms of physical and mental health, your team describe you as being in rude health. Do you feel you are?
I ran 5K this morning, so I'm hoping my doctors are watching and are impressed at my fitness regime. Look, it's really important to look after yourself. It's really important to make sure you're not sacrificing your mental fitness and physical fitness because of the job you love. And it's really important to get treatment. One of the reasons why Keir Starmer made his speech today is our frustration that around the country there are many people missing out on the help they need. I'm not in any way bringing equivalence between what I've suffered and others, whether it's the Grenfell tragedy, whether it's the terror attacks, and you talked about the Manchester Arena. But all of us have got to recognise that if we don't look after our mental fitness and physical fitness, they can deteriorate rapidly. And so I'm in good health. Hopefully that was a first and last issue in relation to my heart. But I'd encourage anybody watching this just to make sure you're looking after your own health.
Because you're bidding for a record third term as mayor next year. Do you think you are fit enough to do it?
Absolutely. Look, I mean, the key thing is to make sure you get regularly checked up. Regular examinations in relation to my heart, in relation to talking to somebody regularly about my mental health, and I'd encourage everyone to do so. Not all these things you need to medicalise. You don't need to necessarily go to a doctor for some of these things. Having a friend to talk to can often help with your mental health. Doing exercise could often help with your physical health. Eating the right things can often help. So I'm not suggesting by any way everyone should go and see a doctor or a psychiatrist or a psychologist, but there are things we can do to make sure we look after ourselves, and prevention definitely much is better than cure. But I'm raring to go in relation to the mayoral election. I can't wait for the campaign to begin. I think everybody in the country is a Tory member is running to be the Tory candidate for mayor. Whoever they elect, I'm looking forward to a good, clean contest.
And you're down there at the Elizabeth line promoting that today, and the fact that it has finally opened officially. What difference do you think that's going to make to travel in London?
Well, it's been almost a year now since we opened the Elizabeth line. Her Majesty, Her Late Majesty, opened the Elizabeth line last year. Over the course of the last year, the great news for our country is we've contributed to the country's economy more than £42 billion. This line is now the busiest line in the country. More than 150 million journeys on this line over the last year, every day. More than 600,000 people using the line. The reason I mention those numbers is it shows how this piece of infrastructure is helping our city's recovery. That's why it's really important for us to persuade the government to invest in these pieces of transport infrastructure. The Elizabeth line in London, high speed for the north, high speed too. We need a new crossrail in London, more investment in our Bakerloo line, new trains across our country.
Another traffic initiative that you've championed have been things like the low transport neighbourhoods. I don't know if you've seen the report out in the Times today, which suggests that their research shows that these low transport neighbourhoods aren't actually achieving what it's hoped they would achieve, because obviously the point of them was to reduce journeys on the roads. their research has shown that there is no evidence that these low traffic neighbourhoods reduce the number of miles driven. And in fact, it could be that they're increasing the number of miles driven because people can't get from A to B through it, so they're driving around it, which is then adding to congestion and miles driven on local roads. What do you think of that? I mean, you know, they're suggesting it's simply greenwashing. It's simply just not making a difference.
No, I think the question is, who are the best people to decide what happens in our communities? Is it civil servants in Whitehall, or is it locally elected councillors decide what happens in our communities? In London, we're a population now of almost 10 million. If everybody jumps in their car, there simply isn't enough road space for people to drive around our cities. So we've got to encourage people to walk, cycle, use public transport. And the evidence with the low traffic neighbourhoods in London, in many parts of London, whether it's Lambeth, Waltham Forest or Newham, is fewer road traffic collisions. When there is a road traffic collision, the consequences are far less serious, so fewer deaths. It's leading to fewer people driving their cars because they're walking, cycling or using public transport. We now have more than 500 school streets encouraging children and their parents and their carers to walk, scooter and cycle to school. So the quality of the air is improving as well. So you're tackling climate change, you're improving air pollution and reducing congestion.
But you're only doing that in the little area that it is. If you're unfortunate enough to live on the edge of one of these low transport zones, what this research seems to suggest is that actually it's getting worse for the people living on those roads. It's not actually cutting the journeys. Yes, it may be cutting road deaths in that particular area, but if it's just forcing the problem elsewhere, that's not solving the problem, is it? It's just moving it to a different part of London.
Well, those boroughs that I mentioned have looked into the issue of displacement. That's what you're referring to, is displacement. And the evidence in those boroughs who have successful LTNs, because they've consulted, they've engaged, they've worked with them, is there's few people driving, but also there is no displacement. The question is this: should somebody in Whitehall who doesn't know a community decide where the money is spent, or should a local council working with neighbouring councils? I don't even think City Hall should decide what happens with these individual streets, because I'm too distant from these councils. I think councils should decide what happens on their streets. If taking back control is to mean what it says on the tin, it shouldn't be Brussels to Whitehall, it should be Brussels to Whitehall to councils across the country.
But whoever makes the decision, the fact is, if this has been promoted as a green scheme that actually improves the environment, and the research shows it doesn't improve the environment, it doesn't matter who's making the decision, whether it is City Hall or whether it's a local council, it's actually not improving the environment in that local area.
But the reason why who decides what happens is important is because where councils decide what happens in London, there's been big improvements, including in relation to the environment. This is an issue of the environment and also health and also the economy. Congestion is bad for the economy. Carbon emissions is bad for the climate. Particulate matter and nitrogen oxide is bad for health. And by councils, not me, not civil servants in Whitehall, not Rishi Sunak, by councils deciding where the LTNs are. You have successful LTNs. Some LTNs aren't perfect. Some LTNs need amending. Some may need taking out. So what I'm saying is council should be in charge of what happens in their communities. If an LTN is imperfect, they'll tweak it. They'll amend it. They'll remove it, because obviously they want to make sure an LTN is successful. This is about devolving powers and resources to local decision makers who will make the right choice in relation to the environment, in relation to the health and in relation to the economy.